right. Today, we are diving deep into a really baffling condition, one that can literally turn a person's world upside down. We're talking about the complex medical mystery of Meniere's disease. I want you to just imagine this for a second. One moment, you're just going about your day, everything is normal, and then bam, out of nowhere, the room starts spinning. And I mean violently spinning. This isn't just a little bit of dizziness, it's a complete, terrifying loss of control. That is the reality for someone right in the middle of a Meniere's attack. So let's start right there, at what you could almost call the crime scene. That sudden, disorienting, and frankly overwhelming experience of a Meniere's attack itself. The absolute defining feature here is a sudden, violent vertigo. It's this incredibly intense feeling that either you are spinning out of control or the entire world is rotating around you. And it's often so severe that it triggers this full-body crisis response. You're talking nausea, vomiting, and even cold sweats. You know, what makes this whole thing so terrifying is just how unpredictable it is. An attack can last for 20 minutes, or it can go on for hours. They might show up in clusters, hitting you day after day, and then just vanish for weeks, months, sometimes even years. This crazy, erratic pattern creates this constant state of anxiety because patients are left never, ever knowing when the next attack is going to strike. So, with a condition this elusive, how do doctors even begin to piece it together? Well, they look for a classic set of symptoms, a kind of quartet of clues that all point directly to Meniere's disease. Okay, so clue number 1 is that episodic vertigo we've just been talking about. Number 2 is a really specific type of hearing loss that comes and goes. Third is tinnitus, which a lot of patients describe as this low-pitched, roaring sound in their ear. And finally, number 4 is a sense of aural fullness. You know, like a pressure or a blockage deep inside your ear. When you have all 4 of those together, you're looking at the classic clinical picture. Now, the hearing loss part is really unique here. It's not constant. It fluctuates. It often gets worse during an attack and then can get a lot better in the quiet periods between them. But, and this is a really crucial point, with every new attack, the hearing might not bounce back completely. And that leads to the slow, progressive, and eventually permanent hearing loss that usually starts with the lower-pitched sounds. So, we've seen the symptoms, right? The external clues. Now, let's go inside the ear and look at the physical evidence, the actual mechanism that's thought to be causing all this chaos. The scientific name for what's going on is endolymphatic hydrops. I know it sounds super complicated, but you can really just think of it as a plumbing problem. See, the inner ear has this very delicate fluid system, and in Meniere's disease, there's a buildup of one of these fluids. It's called endolymph, and it basically creates this overpressurized system. This comparison really lays it all out. On the left, you see a normal inner ear, where fluid is made and absorbed in this perfect balance. But now look at the ear on the right, the one with Meniere's. That fluid just isn't getting absorbed properly. It causes these delicate membranes to bulge and stretch under some pretty immense pressure. The leading theory is that when this pressure gets way too high, one of those membranes actually ruptures, which allows different inner ear fluids to mix. And that's the trigger. That's what kicks off the violent vertigo attack and the whole cascade of symptoms. Okay, so we know what is happening, this fluid buildup, this hydrops. But the next and maybe most frustrating phase of our investigation is figuring out why it's happening. And that is still very much a medical mystery. So let's look at the leading suspects in the lineup. The main theory points to a problem with a structure called the endolymphatic sac not absorbing fluid correctly. But there are other ideas too. Maybe it's spasms in blood vessels, or some kind of allergic reaction, or issues with how the body handles salt and water. It could even be autoimmune or viral factors. Honestly, it's probably not one single thing, but a combination of factors that all lead down the same road to hydrops. And as this unresolved condition carries on, it definitely leaves a trail of damage. You can see this most clearly in how the hearing loss progresses. It usually starts in those low frequencies, but over time, as the attacks keep happening, the damage just adds up. The hearing loss becomes more permanent, and it starts to spread to the middle and eventually to all frequencies. So with the root cause still a mystery, the focus for both patients and doctors has to shift. It becomes less about finding a cure and more about managing this incredibly unpredictable condition, trying to help people reclaim their lives from all the chaos. The management plan is really a multi-pronged attack. During an acute attack, the goal is pretty simple: stop the vertigo. That means bed rest and what are called vestibular sedatives. medicines that basically calm down the body's overactive balance system. For long-term care, it's all about prevention. This is where lifestyle changes come in, like a low-salt diet to reduce fluid retention and hopefully lower that pressure in the inner ear. And then, for the most severe, relentless cases, there are more invasive options. Everything from injections directly into the ear to, as a last resort, surgical procedures. But, despite how severe and scary this all sounds, there is a really hopeful note here. Medical and lifestyle management is actually highly effective. Something like 80% of patients can be managed successfully with these non-surgical therapies, and that allows them to control their symptoms and get back a real sense of stability. So we're left with this condition that we can identify and we can manage, but its ultimate origin is still a total mystery. It's this complex puzzle of fluid dynamics, genetics, and maybe environmental triggers, all locked away in the tiny, delicate structures of the inner ear. Which really just leaves us with that final question. What piece of this puzzle are we missing? What's it going to take for science to finally crack the case of Meniere's disease?